Hey everyone, Dr. Callanan here, naturopathic doctor with a clinical focus in hormones, gut health, and weight loss resistance. I wanted to go through another case study with a 38-year-old patient of mine who came to me with anxiety, endometriosis, so estrogen dominant symptoms. And I'm going to take you through the progression of what we did in terms of testing with genetic testing, blood work testing, and the GIMAP testing, and how we take patients through this progress, how we take them from their pain points, get them feeling better, and then working on the root cause. So what I'm going to do is share my screen so you can see what came up on her GIMAP report. So again, this was really indicated because of the amount of anxiety, the endometriosis that we're seeing, so the estrogen dominance, as well as past history of H. pylori, GERD, reflux, as well as she was having these rheumatoid arthritis symptoms. So seeing joint changes in the small joints of the hands, a lot of pain and inflammation, but her blood work was seronegative. So she didn't come up with those traditional elevations in rheumatoid factor or other autoimmunity factors. So I really wanted to look at the gut because we know things like Citrobacter, Prevotella, these gut pathogens, given the right genetics. So she did have a family history of rheumatoid arthritis. Given the right genetics, especially with leaky gut, combined with a trigger such as a gut infection that has been known to be associated with rheumatoid arthritis, that's something that was really key to address the gut health. So the first thing that we did is we did a 1.5 hour clinical history looking at where this started, how has it changed, what have you tried in the past. We decided to run genetic testing. We looked at how is your body metabolizing estrogen. A couple things came up that she was actually really good at detoxifying estrogen. Her COMT gene was normal, which was interesting because she was having all these estrogen dominant symptoms. And where was it coming from? Turns out it was coming from the gut. Her beta glucuronidase was elevated. So even though she was detoxing that estrogen, it was being reabsorbed. Genetic testing pointed to vitamin D absorption issues, so not able to fully absorb a higher dose of vitamin D. And when we actually ran her initial blood work to check her vitamin D levels, she was only at a 37, so very deficient in vitamin D. Subsequently, we have now got her levels up to 77. We rechecked on blood work, not optimal, but still making progress. So starting with the genetics can give you a really good foundation of what needs to be tested on blood work. She has MTHFR issues, so methylation issues. So talking about diet and how we really want to avoid processed foods, processed grains that might contain folic acid, as well as then reconfirming with blood work, what is your B12 level like? What is your folic acid or folate levels like? Because this can give us a really great indication of whether we need to supplement or not. She also had issues with DRD2 as well as TPH2, which are dopamine, our motivation hormone, as well as our serotonin levels. So what we want to do is we immediately want the client to feel better. If they're feeling anxious, fatigued, we want to address that by looking at neurotransmitters. Then we'll work deeper on the gut health, addressing what issues have come up on the GI map. Typically, what I would recommend is we do a therapeutic trial, get you feeling good, resolve the anxiety, resolve the low energy, work on an anti-inflammatory diet for 30 to 60 days. Then we order the GI map test and we address what issues have come up. If you are on an anti-inflammatory diet, we're supporting your immune system, getting your vitamin D levels much better, you're mentally feeling really good, you're going to be at a much better place to help weed out or kill off any of the dysbiosis or overgrowth of pathogens that we might see. She also has the FTO gene or the FATSO gene, which issues with leptin and ghrelin, more likely to be overweight, more likely to have resistant weight loss. So we want to take that into consideration when we're looking at balancing those hunger hormones, as well as we wanted to dig deeper into the GI map to see if there is anything that is present, issues with certain bacterial ratios, knowing if you're absorbing more calories from the foods that you eat, as well as more prone to insulin resistance, prediabetes, and weight loss resistance, which now we're going to discuss what came up on the GI map. So you can sort of see the progression that we took. Phase 1, get you feeling really good, address your neurotransmitters, address your diet, anti-inflammatory diet, work on the gut, and then as a byproduct of healing the gut in the phases that we're going to go over, the hormones will absolutely improve. She has tried other ways to modulate their hormones through DIM and Vitex and different estrogen dominant supplements, but that didn't really seem to make a huge difference because her detoxification pathways are actually really good. It's more of an issue of that estrogen being recycled from the gut that we need to address now. First page, which is the main pathogens. These are the ones that you would see in a traditional stool culture, the ones that are known to cause the profuse diarrhea, even bloody diarrhea at times. those all came back normal, which was really great. And what I love about the GIMAP test is it doesn't just test for these pathogens, but it also dives deeper into the opportunistic bacteria, the H. pylori, what is the normal gut flora like, as well as those digestive health markers. H. pylori, interestingly enough, came back high. Now, currently, she is not experiencing symptoms of stomach ulcers or acid reflux, but that is something that was prominent in the past. There are people that are carriers of H. pylori, the main bacterium that creates stomach ulcers, small intestinal ulcers, as well as acid reflux. Now, her virulence factors were negative. So the strain of H. pylori that she is carrying doesn't have the virulence factors. Virulence factors are the pathogenicity. So how likely is this strain to cause those clinical signs and symptoms that we see? Now, if she was experiencing GERD, acid reflux, as well as ulcerations, and she came up as positive here, I would go ahead and treat it with something like a gastromend. But because she is not having those clinical signs and symptoms, we're not going to address this right away. This is likely something that she just carries and she is now asymptomatic. Now, if it was to come back in the past, then we have, or come back in the future, we do have basis to say, okay, it's likely H. pylori that's overgrown, maybe stress, maybe you're not breaking down your foods as good, maybe your immune system's not as good now. Then we have a basis to say, okay, we need to treat this. Normal bacteria flora looked pretty good. So if this patient was to take a bifidobacterium or a lactobacillus-based probiotic, probably wouldn't see as big of a clinical impact because she has healthy levels of those typical bacteria. Now, Clostridia is high. We typically see Clostridia high in those who struggle with resistant weight loss or metabolic disorders. So this is something that we want to keep in mind and help to bring back into balance. The phyla, again, you've heard me talk about. All our normal bacteria either fall into Bacteroides or Firmicutes. The same as all the animals can fall into different subclasses, whether it's cat or dog, and then there's a whole bunch of different species in there. The same goes for the bacteria. Now, her Firmicutes is creeping up. It's still within the 10 to the power of 11 reference range, but this is something that we want to consider. We want this Firmicutes Bacteroides ratio as low as possible because then you absorb less calories from the foods you eat, less insulin resistance, less metabolic syndrome, less inflammation. So this is something that we want to help optimize because weight loss is an interest of this patient as well. Additional dysbiosis, we're seeing Staphylococcus, strep come up. We're also seeing a little bit more of the bacillus, enterococcus. So this we want to consider, is there efficient breakdown of foods so that these bacteria don't have the opportunity to grow? Is the immune system good? Is there enough stomach acid to help facilitate that, one, foods are being more digested in an optimal manner, but also that these bacteria don't have the opportunity to overgrow? So that was something we put her on right away, was betaine HCl. Now, you don't want to give someone betaine HCl if they have active stomach ulcers as well as an active H. pylori infection. So we did a trial to make sure that it wasn't causing reflux, and it wasn't for her, but something to consider. You would want to heal the body and eradicate the H. pylori prior to giving betaine HCl if they have an active case. Then we looked at potential autoimmune triggers. Again, the Prevotella and the Fusobacterium, they came up as present in the gut. This could be triggering the autoimmune tendencies because of a concept called molecular mimicry. So bacteria as well as cells, they have these peptides or proteins in their outer surface. You could say that this is like a characteristic that allows the immune system to recognize what this is. So the same way you recognize me from my facial features, hair, my voice, the immune system looks at those peptides as the same thing. So the problem here is that the immune system, what it will do is it'll recognize these peptides that are on the surface of Prevotella and Fusobacterium, and it will say to the immune system, hey, this is not normal, this is not our own cells, we need to get rid of it, we need to produce antibodies to clear out this infection. Great, that's what it's supposed to do. We always have different pathogens and bacteria and parasites that come into our bodies, and our body just takes care of it naturally with the immune system. Now, the problem is the hair or the glasses or whatever characteristic you're thinking of that Prevotella has, it closely resembles, it's not the exact same, but it closely resembles the type 11 collagen of the small joints. That's why we see the small joints affected in rheumatoid arthritis. The immune system puts out these antibodies, and if you have the genetic predisposition to overreact, then what happens is, unfortunately, as a byproduct of trying to clear these infections, your joints are also damaged as well. Now, this is a really great time to intervene because we can help reduce the Prevotella, reduce the Fusobacterium, so that we don't get to a point where there is measurable rheumatoid factor, measurable autoantibodies. So this is a really great time to prevent the progression to rheumatoid arthritis, which is really awesome to be able to prevent that. Now, what we did here is we did a high dose of GI microbe X as well as a high dose of oil of oregano. So we have to have a broad spectrum antimicrobial. Another thing here is Prevotella loves carbohydrates. So really reducing the amount of carbohydrates you have in your diet. She is off gluten, off the processed grains because they contain folic acid, and remember, MTHFR doesn't do well with that. So she is already doing that, but we're really working on reducing the amount of carbohydrates and using something like the betaine HCl or a digestive enzyme just to make sure the healthy carbohydrates that you're having are being properly broken down to not fuel this. Now, she was noticing that her joint pain and swelling came up in a cyclical fashion. So sometimes it was better, sometimes it was worse, and she didn't really know why. And the same thing that can happen in the gut, where these infections can grow at a higher rate and a lower rate, higher rate and lower rate. And that's where you would see the symptoms coming and going, which is really interesting. Fungi, yeast, normal, amazing. Viruses, normal, great. And again, the parasites and worms, these are really tough to treat. They often persist for a long period of time. Don't always respond to antimicrobial treatments. The worms especially often require pharmaceutical use, so this is great that this is not present here. Intestinal health, steatocrit, so the amount of fat in her stool was completely, there was no detection, which is great, so she's breaking down and absorbing the fats. And this is really interesting because she doesn't have a gallbladder. So you might think, okay, if you don't have a gallbladder, you don't have the stored form. Essentially, the liver produces bile, the gallbladder stores it and secretes a bolus when you have a meal. Now, you might think, okay, she doesn't have a gallbladder, we would expect to see fats in the stool. But for some people, their livers can make enough bile and it can slowly trickle and it doesn't cause an issue, and they're properly able to digest their fats. It could also be that she had a lower amount of fats in her diet. So if she switched to maybe a ketogenic diet or high fat diet, this might not be the case, but given the diet that she has now, even without a gallbladder, she's breaking down her fats. Her elastase, which is a marker of pancreatic digestive enzyme exocrine pancreatic function, that's actually optimal. 500 is my cutoff. Even though normal is 200, I say 500 for really good function. But because we are seeing some dysbiosis and some overgrowth, this is where I'm using clinical judgment and saying I still want the betaine HCl there, even though your elastase is fine. Okay, this is where we are seeing the endometriosis, the estrogen dominant symptoms, is because this beta glucuronidase is high. You can detox all the estrogen you want. Essentially, once it's detoxed, it goes into the stool. It has a nice package, pretty bow on it. It says like, hey, anything with a bow, we're gonna remove. Now, the bacteria that produce the beta glucuronidase, the enzyme essentially unwraps it and it goes into recycling. So this is something in phase 3. Essentially, we're doing a killing off phase, then we're doing a repopulating phase of probiotics. Then phase 3 is going to be all about hormones. A big one here is going to be calcium D-glucarate to prevent this estrogen recycling. There's no blood in the stool, which is great. Her immune system is within the normal range, so she's not overreacting to things. Interestingly enough, her anti-gliadin IgA is high. Now, this patient has family members as well as those in her home who are celiac. So they don't particularly, or she doesn't particularly consume a lot of gluten. Now, this could be high due to the fact that she's very sensitive, but also what we see is if you truly have not had gluten in your diet, we really shouldn't see an elevated level of anti-gliadin IgA because this is the immune response. So if you haven't had it in your diet for years, you should really have a normal immune response because there hasn't been that opportunity to mount a immune response because we have said for the last 10 years we haven't consumed gluten. So this is likely due to some cross-contamination. So what we recommend is really focusing on packaged foods. Cross-contamination, are you using the same toaster? When you go to a restaurant, say, I am celiac, I can't use the same oil that the flour-based chicken nuggets were just in. So really focusing on those cross-contamination. And if you're feeling like cross-contamination is becoming more of an issue, take a digestive enzyme when you go to restaurants. Take a digestive enzyme when you might be exposed that contains DPP4 to help break down the gluten protein. Inflammation was good. Zonulin surprisingly was good. So great time to intervene, get rid of the Prevotella and the fusobacteria that could be triggering those autoimmune tendencies. And start now before there is leaky gut. Start now before there is inflammation. Remove the gluten because you are so sensitive to it. And essentially, those are the phases that we're going to go through. GI Microvex, oil of oregano for 4 weeks. Personally, I would rather high dose it for a shorter period of time. And that's just my clinical preference, therapeutic levels. Next is we're going to repopulate with some healthy gut bacteria, and we are going to repair. Whenever you kill off bacteria, there could be LPS toxins excreted, damaging the gut. And then the third phase is address the hormone. So I hope that was helpful for you, giving a brief overview. Some of you may be able to relate having those estrogen dominant symptoms, working on estrogen detoxification, but still not feeling your best. It could be from the beta-glucuronidase. I would highly suggest, there is so much clinical research supporting these potential autoimmune triggers in various autoimmunity disease. Yersinia for Hashimoto's or Graves' disease, and many things like Citrobacter, Klebsiella, Proteus, Prevotella, rheumatoid arthritis. So this is something you have a family history for. You're going to want to test to make sure that your genes are not your destiny. Just because you have the genetic predisposition to autoimmunity, it doesn't have to progress that way if you are taking really good care of your health and specifically looking at gut health. So if you have any questions about that, please let me know, and I hope you have an amazing weekend.